How to take care of diabetic cat.
Your cat had been diagnosed with diabetes, and you were afraid of what the future holds for your beloved pet. What you don't know is, a diabetic cat can live a long, healthy life even after its diagnosis. The trick is that you, as a pet owner, must be dedicated to care for your cat during its illness. Diabetes is not a death sentence for pets. Here is some information to help you understand what you need to do to help your diabetic cat. Regular medical care. After your cat has been diagnosed with diabetes, it is imperative that you visit your veterinarian on a regular basis. Your cat will need regular checkups to check the blood sugar levels and to make sure that he or she is receiving the right amount of insulin. When your cat goes in for a checkup, the vet will ask that you do not feed your cat 12 hours prior to the checkup. While your cat is at the checkup, your veterinarian will draw blood and check blood sugar levels. People that have diabetes are able to check their blood sugar at home. However, this is not possible with cats unless you buy a glucose monitoring system. You will probably ask that you bring your cat in every 3 months for this type of checkup.
Getting your cat insulin. When your cat has diabetes, it is your responsibility to make sure that your cat receives the proper dose of insulin twice a day. The amount of insulin that your cat will need will vary according to your cat's individual condition. Most cats will receive between 3 and 5 units of insulin 2 times per day. It is important that you establish a routine for your cat. Your cat needs to receive insulin 12 hours apart. Most people that have diabetic cats will give their cat an insulin shot at the same time every morning and at the same time every evening.
It is not difficult to learn to give your cat insulin injections. Your veterinarian will walk you through the process, and then you can repeat this at home. Usually your veterinarian will recommend that you give your cat injections between the shoulder blades and the scruff of the neck. With patience and practice, your cat will barely feel the injections. In fact, most diabetic cats know when it is time to get their injection, and they may actually remind you by meowing.
Stocking the right supplies. It is important that you have the right supplies on hand to help treat your diabetic cat. You will need a vial of insulin as prescribed by your veterinarian, syringes, and alcohol swabs. It is always a good idea to order your insulin when you are about halfway empty. It may take a couple days for your veterinarian to order your insulin. Your veterinarian might also recommend getting your diabetic cat vitamin supplements and seeding him or a special prescription diet such as Science Diet W/D. You must be able to see your cat immediately after he or she receives their injection. It is also a good idea to have some numbers to your veterinarian into at least 2 24-hour emergency vet clinics available with you at all times, just in case your cat needs help.
Many people who own diabetic cats worried about the costs that this condition incurs. It certainly does cost money to take care of a diabetic cat. A vial of insulin will cost you approximately $85 and will last you about 2 months. A box of 100 syringes will cost about $30 and will last you 50 days, as you should use a new syringe for each injection.
Prescription food will cost you about $40 for a 20-pound bag. However, it is important to remember that your cat is a part of your family. Most pet owners do not hesitate spending this kind of money on their pets.
Patience and love.
Above all, when you have a diabetic cat, you need a lot of patience and a lot of love. It is not always easy to care for sick and ailing cat. However, with the right care, you can expect your diabetic cat to have many more years of happy life.